Okay, Joyce, we're running there. Sorry, I moved the camera there at the beginning there for those watching. Sorry about that. So for those people or for people watching this video, I'll just give a quick, introduction. Joyce, we've been treating you for 4 months, which is, I was just telling you, is pretty typical. Most people with chronic conditions really takes like about 4 to 5 or 6 months to get things worked out, and we're right on track with you. When you came in, your main complaints were your fatigue. Your energy levels were really low. You were having a lot of depression and some bowel symptoms alternating between constipation and diarrhea, and some weight gain and weakness of the legs were the chief complaints. And so why don't you go ahead and take it from there as far as like how long you were suffering with these things, maybe what kind of treatments you tried, and kind of take it from there.
Okay, my symptoms started like over a long period of time. Didn't even notice them. And then one day I was walking up the stairs in my house and I couldn't get to the top of the stairs. I had to sit down. My legs were just so weak. And I thought, okay, something's definitely wrong. And of course, because of that, I'm thinking, okay, it's old age, and I got depressed because of that, So then when I saw Dr. Beyer's advertisement, do you have this, do you have that? And I'm like checking off every little thing, saying, yeah, that's me. Yeah. So over the 4 months with treatment and everything else, my strength in my legs has been great. I can walk from the car through a parking lot to an entertainment venue without any problem, and I just feel overall, so much better. I don't fall asleep at my desk at 3 o'clock in the afternoon anymore like I used to. Yeah. And I go to bed at night and I'm tired. I fall asleep very well now because I don't have to take naps in the afternoon because I'm so tired.
What would you say percentage-wise is the improvement in your energy levels?
Oh, energy levels is almost like 100%.
Good.
I mean, I used the last couple of years when spring came along, I was dreading having to go out and work in the yard because I knew I'd work out there, come back, sit down. But this year I'm really looking forward to it because I got the energy and I just can't wait to get out there. So
that's great.
I just feel just so much better.
How about the GI, the gut symptoms? How much improvement there?
I guess I still have a few of the issues with the bowel, but I just think it has to do with the whole adjusting of, with what I'm eating and stuff like that.
Overall, what would you say was the improvement there, though?
Oh, very well. I mean, I'm not constipated like I used to be before. I'm giving birth to a baby, and now I'm pretty regular except for the occasional having to run to the bathroom with the diarrhea.
Yeah.
But
still a little bit of that, but good percentage overall, like about 80, 90%.
Oh yeah, 80. I'd say 90-95%.
Yeah.
Is,
so still some issues, but
yes. But overall, my energy level is just phenomenal. Good. I walk with a different pep in my step.
Did you experience some drop into weight too, or?
Yes, I lost 25 pounds over the 4 months, and I credit that with staying away from the bread and the gluten because I was a breadaholic.
Okay. Now, was it hard to get those foods out of the diet?
Unbelievably, no.
See, and that's why I asked, because most people, they're really worried and apprehensive about any potential changes in their diet, and I tell them when we correct these metabolic imbalances, which we've done with you, and for those listening, we worked on a number of different metabolic issues, from the blood test. We worked on regulating your autoimmune thyroid condition, which you had, and then we did some treatments to kind of balance the nervous system. And when you do all that together, it's not that hard, is it?
No, not at all. I mean, now it doesn't faze me to make French toast for my husband or something like that, which I thought I would really, really hate doing. But I'll just have some fruit, and maybe a slice of bacon or something, and dropping the weight along the way, it makes it easier, not eating the bread. Because I know the bread and butter were, a big part of my downfall. And so as you see the weight coming off and feeling so much better, it's easier. Now I even, instead of getting like a gluten-free bun, I just, for a hamburger, I'll just have a hamburger.
Yeah.
hamburger with some, steamed vegetables, and I'm good to go.
But it's not this, gritting your teeth, you gotta
no.
bear through it kind of, you become, it's a lot easier, yeah.
Yeah, it was, even people around me they laugh because they know what kind of bread person I was.
Yeah.
And it's like, no, don't even pass the bread my way. I don't,
Yeah.
it's, it doesn't, faze me.
Yeah, that's great, and that's, for those listening, that's real typical. When we correct these problems, when we identify these problems and correct them, cravings, food cravings that people had really, really diminish or disappear, in addition to you feeling better. And like you described, you become self-motivated to continue on.
I have to admit, the first part of the diet, leaving out the nightshade vegetables and stuff
Which
like
we
that.
had to do with you, yeah.
Right, was a little harder because I love my mushrooms and my tomatoes. But after that period, everything just fell in place.
Yeah. So there's no doubt, and I tell people, for those watching this, I'll just say it takes some involvement, some effort, on the patient's part, and at first it can be a little bit hard, like you're saying, but totally doable, right?
Oh, definitely.
Yeah.
Definitely, especially like in my case, like I said, the bread was, I thought I'm not going to be able to stick with it, but it's been easy.
Yeah, and for those watching also, everybody's a little bit different, but there's some involvement with the patient. It's not like we're waving a magic wand over people. We're working together as a team, but it's doable. So.
Definitely, and it does involve your support system at home.
Yeah.
And and I have that, and my family. So it's they realize that there's certain things that I can't have.
Yeah. So you're a great success story, great changes. Your improvements were anywhere from 80 to 100% with your key symptoms and weight drop, and your energy's better, and you're enjoying life, right?
Yeah, definitely.
That's great. We're glad you're feeling better.
Oh, me too. Thank you.